Good morning, good evening, good afternoon, everyone. Today, I want you to imagine something. Close your eyes for a moment. Imagine walking up to a familiar room, but nothing seems familiar anymore. The faces you love feel distant. The words escape you. The time slips through your finger. This is not a scene from a movie. This is a daily reality of millions of people living with dementia and those who we care for. So, everyone, I am your host, Dr. Mrigna Nagraj, founder of 50 Plus Assist. And today we are in a conversation which is very close to my heart. Because dementia for us is just not clinical, it's deeply human. Today we travel across borders from India, from Brazil to Australia to understand how compassion, community, and courage comes together in dementia care. And joining with us is someone who has just not has studied dementia, but has she's somebody who lives with it, works with it every day of her life. So with me is also my wonderful co-host, Pankaj. Pankajji, beaten on to you.
Thank you, Dr. Mrigna. And it's a pleasure to again be on this platform to host it with you. Today, we have a very special guest, Daniela Montero from Sydney, Australia. Daniela is the founder of Blue Mountains Dementia Action Group, and she is a nursing professional in the aged care sector, especially in the dementia uh, area. And she is uh, she's doing her bachelor's in dementia care, and she's also holds a diploma in nursing from Australia. So we really look forward to the learnings and her experience in the aged care sector in Australia, specifically because the amount of standards and guidelines what Australia has been putting in for the reference of the world as such. So I think they are the leaders in the education part of aged care as well as in creating the standards. So Daniela, thank you for coming on the show, and we really look forward for an interesting session with you.
Oh, thank you so much. I just wanted to thank you for giving me the opportunity to share my knowledge with you guys. So I really look forward to.
Great.
So Daniela, we have been speaking off camera also about the university you're studying from, University
Mhm.
of Tasmania being one of the most leading universities in the world. Especially when it comes to, dementia care, latest dementia researches. And Australia as a country also is a very pioneer country. When we talk about dementia care or researches or norms or anything that comes up related to dementia. So for you, what was the most significant challenge you see in your daily practice, especially coming from a place of a lot of knowledge, a lot of I would say background into the field. What is the most significant challenge you feel?
Yeah, well, to first explain, I show the way that my background. My nursing and community work started around 10 years ago, but my journey with dementia started around 12, 13 years ago when my great grandmother was diagnosed with dementia. But she came from English wasn't her first language, was second, and it wasn't even that good. She could barely speak English, and so did my grandmother. So when she was first diagnosed with dementia, this is 15 years ago, we didn't know what dementia was. We weren't educated in dementia, so our journey was not the most positive one. We couldn't support her in ways that we know now that could have supported her. And there were so many problems that came with that dementia. Also, my grandmother couldn't speak English, so she couldn't talk to the doctor. She couldn't talk to the nurses. And it was not a positive one, but I decided to make that my mission to support others that English is not the first language, also others that they want to learn but they don't know where to start. And just I repeat the word dementia, so we break down the stigma and we start talking about it. So working in a hospital, I have worked in hospitals, nursing homes, and home cares, which is going to people's houses. And reflecting on this, I always go in there thinking this could be my great grandmother, and that changes. This gives me empathy, and the ability to connect with others. And as I said, for example, now thinking about it, we tried our best. In general wards, we still don't have a ward special. Not every hospital has a ward special for dementia. And when I was working at the hospital, there was not that much education for the nurses, for the assistant nurses and dementia. So we will see the patient acting out, but we didn't know why. And often the quickest solution was to medicate them, which it was not the best. And then sometimes they became more aggressive and more confusion. And that's how it was. But in the past 5 years, we have seen more dementia courses that are free, and we can dig deeper. We work with the whole family. The focus, we realize how important the family is, and we dig deeper to the signs and symptoms. There's still, of course, a lot of work to do everywhere. We still need to educate more nurses and assistant nurses and other health providers. But as I said before, there's a lot of free services for volunteers, for carers, for people that just want to learn about it. As we said, the dementia, the Bachelor of Dementia that I am doing. So the opportunities here in Australia are to learn. We try to give patients personal care. Dementia is not the same for everyone, and no one can be treated the same. What worked one day is not going to work the next day, unfortunately. And that's why we try to be open-minded to everything. And I always reflect back on me. As we know, I specifically focus on people that English is not the first language, because a lot of people that as dementia progresses, they lose the English that they learn and they go back to the native language. So I always try to say, this could have been my grandma, and I try to be more empathetic with them.
Okay, that's, I think, very interesting what you said. So,
no, we understand actually also the communication barriers can be really huge, especially when you're talking with somebody with dementia, and with the behavioral changes, the emotional toll, the time pressure, and also a person going back to their first language is the commonest thing we have seen, and this can be really challenging, especially in a multicultural, multilinguistic country like Australia, which has people from everywhere across the globe. They aspire to be in this country. So that's very interesting, actually.
Yeah. Well, it's not just the language. We also have so many different cultures, so many religions. So we have to be very cultural sensitive, that we are respecting everyone and we treat them the same. But as I said before, that family is the main point for us to be able to give them a good treatment.
Well, I think when we spoke about this multicultural and multi-religion perspective, my second question or our second question would have been that. But just prior to that, I would just like to understand, what is this Dementia Action Group or Blue Mountain Dementia Action Group? Because that is something I was very keen to know.
Yes. So I have it goes back to my other questions, but I met this amazing woman. Her name is Sana, and like me, she has a very similar journey where her family member was diagnosed with dementia, but it wasn't her first language either. So she went through similar struggles that I did, and we see that even though, because dementia is itself really hard to talk about, a lot of people will not talk about it, will change the word dementia to cognitive decline to avoid the word. It's like a lot of people fear the word, to be honest. And that also becomes a lot of with education. As you educate yourself, the word becomes a bit more easier to digest, if that's the way we want to say it. So we created the Dementia Action Group, which I am the founder with her, but I focus right now in Blue Mountains, and we open in different regions. And depends on the regions that we open up, what is needed in that region, what multicultural groups live there that they need more, what they might need in the Blue Mountains, they might not need in Parramatta, or they might not need in Liverpool. So we try to adjust and collaborate, work together with them to get a better outcome. So I run workshops in Spanish, and Sana runs workshops in Arabic. So next year we want to incorporate more languages and things like that. So we're trying to break the barrier for those people that we know will eventually lose the English.
That's pretty interesting to hear about it. And considering also that Australia is often described as a very inclusive country. From my experience, if you would have any, how do Asian people, especially those with native language like Indian, Chinese, Thai, how do they engage in residential care, home care, or community care services? Because as we understood, language can be a very major barrier. And have you noticed any differences while caring for any South Asian community as compared to somebody who's Australian born, older adults in terms of, let's say, their expectation, family involvement, in terms of food, etc.?
Yep. So I did a bit of research as well, so I could give you the right information. As you know, we welcome people from any part of the world. The number of Indian-born people using aged care is actually relatively low compared to the rest of the population. Because as for late 2024 and 2025, 1 in 3 people using aged care were born overseas. However, that group falls into more UK, Italian, and Greeks, which people that migrated before. And there's approximately 845,000 Indian born in Australia, making them the second largest migrant group here. In saying that, I see that people, South Asian cultures are more to do home care instead of residential aged care. And this is just based on research in Australia. This is the home care is more popular service for Indian seniors, as is more cultural preference for aging in place within the home. The residential aged care is lower, but the government is trying to make some funding for specific projects. As I am aware, in Victoria, South of Australia, they are trying to do specialized Indian care wings to make it more culturally inclusive, to have traditional meals, prayer rooms, and staff who speak like Hindi or Punjabi. And we really hope that this works very well so they can replicate in other parts of Australia. We see that research shows that some South Asian cultures see caring for the elderly parents at home as a non-negotiable, it's a duty. And moving parents into the residential care could be seen as a failure of the family, leading or in a sense of shame and stigma. Whether comparing that to an Australian model, it's more emphasizing independent living in aging in place. So we have professional services that will come to your home to give you the autonomy. So elderly living home alone will have people coming to clean, shower, meal prep, and as a South Asian culture that will have family doing this for them, the Australian people have service providers doing it. So they're more open to going to live into residential care. The impact of this in South Asian families is that they wait much longer to ask for help. Normally, when there's a crisis or an emergency, that's when they will say, we need the help. And that's a bit hard because sometimes we can't just get there and help them as we want to. And as I said before, it's also really hard for mainstream facilities to be able to accommodate all the cultures that come here. And as people progress in the dementia, they lose the English. So yeah, that's a few differences. Also, last but not least, the facilities here in Australia were built more in a Western holiday sort of things, which is Christmas and Easter. Whether I know South Asian seniors require different spaces for daily rituals or celebrations. So those are some of the common differences, if I explained it properly. I hope so.
No,
Yeah, yeah, you
definitely
did
it
it.
has been very interesting, very insightful. Because I've been looking up to the Australian standards as an individual and been doing a lot of comparison with the American standards, the British standards, the Canadian standards, and to a certain extent Hong Kong standards, and the amount of advocacy, amount of information Australia as a country who have been providing, and in this particular domain is I think it's really remarkable. So, Daniel, my next question is, what is the awareness level, the prevalence? One is the awareness part of it, second is the prevalence part of it, and third is how does the government structure works in the service delivery aspect of aged care, both at the institutional level or residential level and care at home. Because I'm not talking of the Asian population or
Mhm.
the other population, but Australia as such. What is the prevalence of dementia, especially?
Oh, well, yeah. So as seen for 2025, it's an estimate that 433,000 Australians are living with dementia. 30,000 of those are living with young onset dementia, which is people younger than 65 years old. Now, these numbers are sometimes they're based on English speaking because there's people that there's people that have been living in Australia for many years and they don't speak English, and therefore we become with all these other barriers that come with this. They don't seek the help. It's still a very big stigma to be living with dementia, and sometimes people just hide it behind. And those are the numbers right now. In Australia, dementia is currently recognized as a leading cause of death and is one of the top national health priorities. There's a lot of campaigns going on around it. Awareness has evolved from seeing it as a normal part of aging to understanding it's a complex, a terminal condition. Everywhere we go, we say it is not a normal part of aging. It's completely different. You need to ask out for help, and we advocate for that. There's still stigma. I still go places and do workshops, and as soon as I say we're going to talk about dementia, there's people that are like, oh, okay, dementia. Like, no, just say cognitive decline. I'm like, it is dementia. We have to use the right words. As I said, like in the last couple of years, Australia has become very active when it comes to dementia. We have launched a national dementia action plan that is meant to, it's a 10-year plan which has 8 key actions, which is promote equity and human rights, which is ensure this dignity with people living with dementia. Living with dementia doesn't mean that we take your voice away from you. You still have a voice. And that's why we say it's so important, the early diagnosis. As soon as you're diagnosed with dementia, you still have a voice. Get your affairs in order. All your legal documents, as you can do it, please do it. We encourage this in every workshop that we go to. You have a voice, and there's seniors' rights here that if you are not feeling secure or safe, please reach out these numbers. We also tackle stigma and improve the awareness, as I mentioned before. We call this, there's a lot of dementia-friendly communities that we call them, that, for example, we're trying to make the Blue Mountains a dementia-friendly communities. I hold meetings once a month, and a lot of people come to my meetings, service providers, people living with dementia, and we say, okay, we live in the Blue Mountains. What do we need to support our seniors? Because I tell everyone, we are all going that way. No one is getting any younger. So it is important for everyone to tackle these things. We also try to support carers the most we can, because being a carer is a 24/7 job, and you don't know what it's like to be a carer until you're a carer.
So that's very interesting, Daniela, when we're talking about especially the Asian communities struggling with more preemptive arrangements versus, looking for something when the emergency is just right on the door.
Mhm.
So which is, I would say, very Asian for us, to be honest. And I totally understand this perspective, whereas in home care works much better versus an assisted living place, because aging in their own home is seen as their right, as their basic level of dignity at times.
Yeah.
And at times it is also considered like a social stigma. Oh, your kids have abandoned you, this is why you have to go into an assisted living, without understanding the actual need for it. So I totally understand from where, the whole thing is coming from, and, it can be very challenging. So since you're working in awareness, you're working with various communities of various, I would say, languages now. Like you were talking about Sana doing in Arabic, you doing in Spanish. So, if you had to choose, let's say, a technical skill or an emotional presence, what do you think makes much difference in dementia care? A would be my first part of the question. Second, we've also seen, like, especially like I've also been working with certain communities in Australia, we've been volunteering and other things. So we have also seen a lot of caregivers are from places like Nepal. So do you also believe Indian caregiving workforce can explore similar opportunities, or what preparation truly matters, especially when working with somebody with dementia?
Yes, so I think it's I think it's very important. Working with people with dementia is very hard. It's very mentally draining. Um, so for me, it was a job that I took gladly because I had that lived experience with when we, for example, I give an example, when my great grandmother had to shower, we will go and shower her because we didn't know back then it could have been a sensory thing or anything like that, but she will hit people, and we're like, you know what, we'd rather us to get hit than the nurses because we're family. So we will go there and we'll shower her and she will hit us. And even though it was hard to live through that and not understanding the struggle that she went through, now that I'm in my position that I have learned what she went through, I am more open-minded. So a lot of people with lived experience have a lot to offer to others. And I think that is amazing. But also, like, you learn as you go. You have to have that compassion when you come to working with people living with dementia. I do know, as a health provider, I'm not totally aware of how about the Indian force and all that. But I do know that the Nepalese community has become highly visible and like a vital part in Australia care sector. But the Indian force is actually the largest contributor for the multicultural communities up here. We do know that Australia is currently facing a shortage of over 5,000 of registered nurses and tens of thousands of care workers, because if you think about keeping people home, we do need to help those people that are living at home. So we need to provide those carers that do the feeding, the showering, the cleaning for them. As we mentioned earlier, the Indian senior population in Australia is growing, and we will need those staff that speak that language. That will also be needed. I do understand that it's a competitive process to come to Australia, but I'm not sure how more I can give you more information due to my lack of knowledge.
No, I think what you have already uh, given is itself is very insightful, because I've been following on LinkedIn and other platforms and seeing that a lot of Nepalese women, especially youngsters who are going there and doing your that certificate 1, certificate 2, certificate 3, and community working worker certificates, and a lot of them I have taken up education in this particular field. Whereas Indians, what I have seen is they are going for a specific role over there. They don't want to probably go as caregivers. They want to go at more of a kind of a managerial positions.
Yes.
So I think
Yes.
that is probably the difference in the mindset of the Indians and as Nepalese. But I think yes. So just as an extension of this question, do you think uh, there could be a kind of a collaboration between India and Australia, but I'm talking from the either from the private sector or from the government thing, that these particular courses, what you have, the aged care course or the certificate 1, 2, can be done in India, and then when people go there, they can follow it up with a couple of hours and be certified in that. Because once someone goes from India, then they have to again do the entire course. So,
Mhm.
as a long distance course, is there a possibility you think can be done?
I think with this new 10 years mission that we have given Australia, it is a big possibility that this could be done. Of course, there will be more that needed to be researched, but yes, Australia does have a lack of carers coming to Australia, lack of carers in Australia. So we do need more people caring for our elderlies, because there's a big saying to keep people at home as long as we can, because nursing homes are not equipped, like let's just call them old school sort of nursing homes that were before, that weren't structured the way we think now. Like, for example, dementia wards, they were like plain and there's no color and they're just locked in there. Where now they're doing a different approach, putting sensory rooms, making sure there's this light, this color affect this way and things like that. So we are improving in those sort of things. But if we want to keep people at home, we need, as I said before, we need to have the staff to have them. And right now we're very short on people.
Yeah, we understand that, I think, and it's a problem in some other nations as well as we are encountering. So, what do you think about community groups or local initiative like yourself, especially for the families who feel lost after the diagnosis, What do you think, what kind of impact it is creating, or any impact story or anything that you would like to share with us?
Yeah, so I am a very, very proud founder of the dementia action groups. When I had my meeting up here in the Blue Mountains, I said, let's bring everyone together and we all collaborate. There's all these service providers that they work within themselves and they don't talk to each other. And I was like, no, that's very silly, because we're not sharing the information that we need to share to care for people. This is not about a service provider gaining clients and getting the funding and for themselves. This is something bigger than that. This is our elderly. I always think that thinking for an elder person, you have to show them respect. And the way that I still respect the memory of my great grandmother is doing things like this. For example, the Dementia Action Group is a group that was created to break down the stigma. We work with a lot of multicultural families, people living with dementia. For us, it's very important for people to feel seen, to respected and supported. Dementia doesn't discriminate, so why should we? Dementia is to any person. It doesn't matter the color of your skin, the language that you speak. So we try to bring people together to share understanding and share the kindness. We try to turn this fear into confidence. We have seen many people that come to our workshops and they leave with a smile. Or I have meetings that I see people just writing their notes, and that's just, I'm like, all right, this is why I'm doing this. This is why this is so important. We have met so many people, lived experience, that they think, oh, I just looked after my mom. I'm like, no, what you did was amazing. Empower that, talk to other people, share your knowledge. We do the virtual cafes that we connect with people once a month at the end of the month, and we share a different topic. In January, I think we're going to have elderly abuse. And we just talk about it. What do you think it is? And there's not a right or wrong answer. And we just educate. We don't want people to feel ashamed because they don't know. We want to empower them. So we're very excited that next year we have started the Spanish and Arabic groups, but next year we're going to be more established. And we're truly looking forward to reach out to other languages and be able to cover more cultures.
No, brilliant. I think these kind of initiatives make it more inclusive, and it shows the social development and of the country. And probably that is where the difference happens. That when we say a socially developed country versus a third world country or versus a developing country, I think these are the finer areas where one has to be person centered and be more open to different cultures and different religions. So, Daniela, I just want to understand, since you've been talking about your grandmother and great grandmother, uh, and they being from Chile as such, have you ever been able to actually do a little research or a little understanding of how dementia is in Chile as such, or the Latin American countries?
And now that I've been very involved in dementia, I've been trying to reach out for services in Chile about dementia. I haven't been able to be linked to anyone yet, but there is some services. It's not to the extent that it's in Australia, but I am more than happy to collaborate and share my knowledge over there and be able to one day, I don't know, maybe go and see how it is over there. It will be amazing to reflect back to where my roots are from. and where my great grandmother and grandmother, well, where I was born over there as well, it will be amazing to be able to help them, empower them as well. I have, so it's, I only came here when I was 14. So my Spanish is not the best, especially in the grammar area. So when I have my workshops, I will message my dad and say, hey, dad, can you read this for me? Did I write it properly? And he'll help me out. So I'm already collaborating with Chile.
That's a wonderful way of collaboration, especially via family.
Yes.
And, so, Daniela, this would be our last question to you. So, for caregivers, especially who are listening to us today, those who feel at times really tired, unseen, emotionally drained, what would you like to say to them, not as a professional only, as somebody who is an educator, as somebody who is a fellow human? So, what would you be your message for them?
Speak up, try to find help. Sometimes the help won't be from home. It won't be a family member, but there's always someone there that is willing to help and support you. If we talk about dementia 30, 40 years ago, we didn't have our phones. We didn't have that connection that is a bit easier now for us. Easier to find resources online in our own languages and things like that. So educate yourselves. It's so important. Once you understand where dementia comes from and why people living with dementia act the way they are, it's much easier for you to emphasize on the person and don't think about the symptoms, just remember who that person is. I always tell everyone, if you're caring for someone that you love so much, record them, record the voice, take photos, and enjoy every moment. It's not about people living with dementia coming into our reality. It's us being able to join in their reality.
So it is interesting because I remember my days when my grandmother was diagnosed with dementia. We were really young, and those days selfies and TikToks were in trend in India, and we would make funny TikToks with her during that time. And I understand totally. I mean, I think that really helps to even uh, in a way dissipate the stress in the
Yes.
situation, because things can be really, really stressful and very triggering
Yeah.
at times for individuals. And at times, one can really feel a lot of loneliness caring for somebody with dementia. And I think it's the most golden words: look for help, ask for
Yeah.
it. I think these are the golden words I would say by, especially when somebody is caring for dementia, somebody with
Yeah.
dementia, you know.
Yeah.
So thank you so much for the wonderful words, Pankaj ji.
Mrigna, thank you. I have one last question from my side because that is an area which I have been involved for the past 20 years and it's very close to my heart. So, Daniela, since I've been doing a lot of research on the built environment and all the architectural part of it and the different formats. What I've seen is the Americans call it long-term care, and then they have the CCRC where they have all the different levels of care: the independent, assisted living, and the nursing care. Now the Britishers call it memory care or dementia care facilities. Australia, I think, when it comes to independent living, probably they call it retirement villages, not
Yes.
retirement community. So I just wanted to understand: are these in Australia? Are these standalone, the independent living, the retirement communities part, or they are part of a larger housing group? That is one part. Second is, how are these memory care facilities, and how big are they? And are they standalone facilities, or they are part of a larger senior living facility?
Yep. So there's different ones. There's Australia is always changing and evolving. There is ones that the start is a big area. Let's explain it that way. They started with independent living where people have minimal supervision, minimal help and things like that, and they just go live there. I think it's over 55 that they're allowed to live there. And as they get older and their needs change, they will move to, let's say, to a smaller area, departments where there's more nurses near them and things like that. And then slowly progress into more care. That's one of them. Then there's the nursing homes that is just nursing homes. That is, I would call it more kind of the old-fashioned way that used to be, where it's a big, just different rooms and people live there and they have to follow strict times and things like that. And there's also, they're doing their homes now, that is houses that people live in these houses with supervision 24/7, and they're more flexible, and they try to keep the people living as they were living at home, and they're trying to keep them more active, helping out, still being supported, but still feeling as an individual. And what was the second part of your question?
The final one was, what is the kind of a facility for a dementia care home? How
Yeah,
big
so
are they, and are they independent buildings, or these dementia care facilities or the memory care facilities, what we call them? What is the size of it, and are they independent buildings?
yeah, so as part of the government for the 24-25 new reformity that they're doing with dementia, they are actually working with health professionals, with families. Been a part of a lot of research of how we can improve the dementia wards or dementia units. So now they're being more dementia friendly, where, as I mentioned before, they're trying to do sensory rooms. We are focusing on how the colors affect people with dementia, the textiles and things like that, breaks that they can give them. I think in Tasmania, there's an amazing dementia village, I think they call it, where they are open. The rooms have their own color so people can identify where they live more better. The government has expanded, they call it the Specialist Dementia Care Program, where is a scale of units for people with very complex needs that they can live there. But I think it's, as I mentioned, that's a fit all in one. It's the same here. There's different types of living arrangement for different sort of people. So yeah, but I think the main one is just we try to keep our elderly living at home.
I think very well said, Daniela, and very well summarized. So, as we have come to the end of this conversation, though we would love to keep talking more and more about it, I think of something very simple. Dementia only doesn't only changes the person who is diagnosed. It's quite changes the rhythm of the entire family. A daughter who's
Yes.
a daughter becomes a parent, a spouse becomes a caregiver, people forget their secondary languages, and love, I think, finds a new language in itself, you know, when caring for somebody with dementia. So, thank you so much for sharing your point of view, and not only your point of view in terms of what Australia is doing as a country, but also your point of view in terms of the care that is a very inclusive care for the multicultural, multilingual community that you are serving. So thank you so much for coming here and being the part of this conversation.
Thank you,
My pleasure.
Daniela.
Thank you so much for the invitation. Thank you so much, both of you. I really look forward to keeping in touch.
Thank you very much, Daniela. It was a pleasure to have you on the platform, and really enjoyed learning from your experience in the Australian sector. Thank you very much. Right.
My pleasure. Thank you so much. Thank you. Bye.
Bye bye.